My name is Mark Henry. I'm the Head of Mental Health and Behaviour Support for Exemplar Health Care. We're here at Fareham House, which is our central services office. My role is sort of wide ranging. I cover everything mental health and mental capacity related, behaviours of concern. Specifically, with Radar Healthcare, I monitor incidents, trends, analyse things that are going on in the services, and my team will respond to that, hopefully proactively. From a colleague and staff, a colleague and service user perspective, the overall impact of implementing Radar Healthcare has been an improvement in quality of life. And that's in a number of factors. So in my own area, we've seen a reduction in restraints, we've seen a reduction in injuries through physical interventions, but I also know we've seen reductions in meds errors, we've seen reductions in a wide range of quality areas for a business, for a service that we provide, but all of those improvements in quality have a direct impact in those residents' quality of life, and then also the staff's ability to do their job effectively, because the less time they're spending dealing with those sorts of incidents, the more time they can spend doing the positive, proactive work with the service users to make sure that they're enjoying, the best in their lives. Radar Healthcare contributes significantly to creating a safer and more supportive environment. We use Radar Healthcare to monitor incidents. We use it for a wide range of other things, but the major part is the incident management, the event management, where we're looking at incidents that are occurring across the business. We're improving those overall, and that contributes to safer services. And in the end, you have to build good quality care from safe services. If the service is unsafe, nothing else works. So we build safe services, and then we work on the quality with safety as a foundation. So Radar Healthcare allows Exemplar Healthcare to have that safe environment through which we can build really positive, supportive environments for people to live in. Since implementing Radar Healthcare, what we've been able to do is have a very real-time oversight of incidents that occur out in the services. So previously, Exemplar Healthcare relied on paper documents and sort of manual processes for alerting the right people and getting the right responses. Since implementation, what we've been able to do is we get real-time notifications when an incident occurs and a staff member logs that. The various people in central services know about that straight away. It's reduced that delay massively, and we're able to provide support to the services much faster than we could before, in order to reduce incidents over time, and we've seen evidence of that in many areas up to now. The service users, for them, it's safer and better quality care, and that's really what we're about, is providing the best quality of life, and safety is a huge obviously factor in that. We are services that deal with we have lots of residents that display behaviours of concern or have other risk factors, falls, things like this. If we can reduce those events, then obviously people are able to enjoy a much better quality of life. So it's a real improvement for us. One of the things we have noted is an overall trend in a reduction through injuries related to physical aggression, which is one of the things that I monitor very closely. We've also seen a 50% reduction in incidents of physical restraint over, well, year on year actually, which has been a fantastic achievement. So although I don't have like I say, a specific example, there are many of them every 4-week period that we do the reporting. We see these reductions. Exemplar Healthcare has a number of initiatives to reduce those risks. Depending on which department, we all monitor different areas. So for my department, it's around behaviours of concern, injuries through physical aggression and physical restraint. The initiatives we run is a referral system for and a responsive system for behaviour support. So where we see any spike in incident rates, or if we see a particular severe incident, we can send staff in to respond to that in the services. They'll go out, role model, help, and Radar, obviously, Radar Healthcare assists with that, in that we were able to react much quicker. So rather than waiting for people to come to us to ask for support, we can see the trends in real time, we can see what's happening, and we can go to them and provide that on a much faster basis. Radar Healthcare's technology supports teams in supporting people with behaviours of concern, in that well, it goes right back to the build process, actually. So from a very fixed, regimented paper system, we were able to develop Radar Healthcare in the build to provide the information that we needed at each report. So every different type of event has a different workflow, a different set of questions that the staff are asked. This provides us with much fuller information, much more accurate information that we're able to respond to much better, because obviously the accuracy of the information we get depends on how we can respond to that. And particularly with behaviours concern, there is never any one single risk factor. So really the more information you can gather about these events and collate, the better we have. So from the building of the Radar Healthcare system into the reporting from the staff, and then the collation of data later, so being able to export all that information, gather it together using the report system, that's been fundamental, really, in order to be able to respond. It's, there's often a feeling from colleagues at the front line of something's happening all the time, or they have views on the way incidents are working, but we can gather that data really quickly. We can present them with trends and graphs. We can show them how it increases at certain periods of time of day, or certain staff members are encountering more incidences than others. So there's loads we can do with that fullness of information that we get now. We had a large working group of people involved in building the Radar Healthcare system from the outset. So myself, the head of quality, head of health and safety, we all have sort of different paths within the workflow of Radar Healthcare. So we made sure that we built the things that we needed for each of our different departments, and tried to work together to make sure those were sort of consistent workflows throughout, and provide that consistency of data across. So yeah, my team was part of that, and so we're a wide range of others. There's quite a lot of involvement there. The flexibility of the build process was really good. I think the simplicity of it was one of the key things, in that because we were able to do a lot of the customization ourselves, whereas you find with other electronic systems, you can often be dependent on sending your requests to them to ask them to make them, and then they come back and they need to be changed and tweaked. And at least what was positive about Radar Healthcare was we were shown how to build it, and then we were able to do that for ourselves, and then we only needed to rely at that point on Radar Healthcare for the more complex things, or where we couldn't sort of work out what we were supposed to do with something. So we found that really useful, and it was, there's good flexibility with multiple workflows in a wide range of areas. So yeah, it was really positive. Radar Healthcare helps to improve behaviour support strategies in two major ways. So, as I've alluded to before, the fullness of information we get, the amount of data we've been able to obviously put mandatory fields in the forms that are completed. So we're getting much better data, the quality of it, and we're also getting much more of it, and it's easier to collate using the reporting system, and then we export a lot of the data to a Power BI structure, so we can see it at a glance, really, exactly what's going on. So from using those things, we can develop much more accurate behaviour support strategies that are much more likely to be effective first time around. Behaviour support is a process of evaluation and replanning based on evidence, and Radar Healthcare helps to give us that evidence to do that much better. Yeah, positive behaviour support as a model is becoming bigger and bigger across all different sectors, particularly in adult social care. it primarily was a learning disability focused model, but it is rightly so becoming a model that's applied to all systems and all areas of work. So we were quite ahead of that. So Exemplar Health Care was looking at positive behaviour support quite some time ago, but it is very limited when you're using a paper-based instant reporting system. Like I say, you respond so late, and the information accuracy is hard to get. So having an electronic system for PBS use is really important. And like I say, it's all supposed to be evidence-based, so gathering that evidence is paramount to doing it properly. The feedback from the staff in relation to Radar Healthcare, I think, has been mixed. There is always an element of our colleague team that struggles with technological systems, technology in general. However, one of the real positives is the ability for everybody to log an incident at the time that it occurs. It's very easy to do. The forms are set so that they follow the workflows through, follow the questions. There's mandatory questions, there's optional, but it's very simple to do. So in general, I think the feedback has been very positive. People are supportive of anything that makes their jobs easier and a little faster and allows them to spend more time with the service users, working with them directly and not spending their time on paperwork. So I think overall the feedback has been very positive, yeah. So the DOLS process is quite new to us on Radar. Obviously, we've been managing that on paper for quite some time. So Exemplar Healthcare has relied on paper trackers or typing them on computers, printing them out. We've used multiple spreadsheets for various alerts and things like that, and it's all been a little bit mixed up. So just not all that long ago, we looked at what we were able to do on Radar Healthcare in addition to the instant side of things, having I know some of my colleagues have been working on audit systems and other things, and it became apparent that it would be much easier to manage those through the Radar Healthcare system than to do it on paper or any of the other sort of manual systems we were using. So myself and the project lead for Radar, or project manager for Radar, quickly set it up. It was very easy to set up because it's quite a simple process, and then we're now live across all the homes with the DOL system, and we're able to not only provide things like the notifications and alerting systems through Radar for managers, which is really useful, making sure that DOLs don't expire, everything's renewed in time, but we can have central oversight of that as well. So myself and my colleagues in central services can quickly go and see who's subject to DOLs in a service, whether there's any conditions and how those are being met. So yeah, that's been a really simple improvement for everybody, and the feedback for that's been really positive. We were piloting the DOL system in a couple of services, and we had multiple requests at that point for people just asking us if they could go straight to it. So we were really pushing on an open door with that one. It was good. Radar Healthcare helps Exemplar Healthcare in analysing data in a wide range of ways. We're able to see the data much quicker. We're able to look at. I can very quickly get access to data on a wide range of people across the whole organisation or by individual. So I collect that data. I can do it with a few clicks of a button. We export everything into Power BI, so I have a range of dashboards, meaning that I can focus all the information down by either the whole company, by region, or by individual service or service user. Once we've done that, we're able to analyse that data very quickly. I can take summary of all the events, look at a hypothesis for why a behaviour might be occurring for an individual. I can contact that service then and make suggestions on behaviour support strategies for that individual. Or it might be that we just have a particular trend across a whole service where we're seeing a number of service user on service user aggressive events, and I can look at where that may be occurring. It might be on a particular unit or a particular shift, and say, have you looked at these sorts of factors in that? So it's really been positive in terms of analysing the data and making sure that we can provide that support to people. We use the data to pinpoint specific areas, and we also then respond to specific referrals based on the data that we have. So homes will refer to my team where a service user is deteriorating or in crisis and having a lot of events, and we're able to quickly pull all that information together. We provide support from that in terms of we have clinics with a consultant psychiatrist and an MDT that we run via Teams. We visit the services in person, or we can provide remote strategies for people to work with. So we deal with about more than 100 referrals to my team every year, where I consider each of those could potentially be a breakdown of placement if we don't intervene, because the services are contacting us because they're having problems, and Radar Healthcare allows us to pull the information for all of those referrals, get them together. We can look at all the different factors involved, and then the strategies that we give are specifically related to the evidence we've received. So it's really good. Yes, I'd definitely recommend Radar Healthcare to other organisations. I've used other electronic systems in the past that I've found to be more complex, more difficult to arrange, certainly harder to build and work that way. Radar Healthcare has been it's been a real improvement across the board in terms of the systems that we're using. I would absolutely recommend it. Yeah, I think the customization, the ability to report from it, and then the link ups with systems like Power BI has been absolutely amazing. So yeah, definitely recommend it.